Will the U.S. implode as its birth rate declines? According to the U.S. National Center for Health Statistics, the overall fertility rate in the U.S. was 1.64 births per American woman, a new low. This birth rate is around 21% lower than the replacement level fertility rate of 2.1 children per woman, which is widely accepted. The replacement level fertility rate is the fertility rate that a country requires to maintain demographic stability. Lower levels indicate a risk of slower economic growth and lower government revenue, as fewer people are available to work, pay taxes, and fund government social insurance programs. In terms of decreased fertility, the United States is not alone. The European Union, for example, recently averaged 1.5 births per woman. The average number of children per woman in North America is 1.7. Australia has 1.7 births per woman, China has 1.7 births per woman, Japan has 1.4 births per woman, New Zealand has 1.7 births per woman, and South Korea has 0.9 births per woman. Many governments in developed and fast-growing countries are taking this trend seriously and putting policies in place to counteract it. For example, to address its below replacement fertility rate, Germany has implemented several family policies over the last 15 years, including extending the parental leave allowance to 2/3 of total annual income for the first year. For the past 6 years, Poland has promoted family-friendly measures to boost fertility rates. The Hungarian government launched a family action plan, allocating 4.8% of the country's GDP to initiatives that support families and encourage births. However, not everyone is concerned, and some demographers suggest that current low fertility rates should not be a cause for alarm. According to these demographers, before the cost of an aging population becomes a societal burden, the fertility rate could drop to as low as 1.5. Nonetheless, as the United States approaches this level, the question of what policies are required to sustain the economy arises. Some note productivity increases in the absence of population growth can be attained by capital substitution for labor. That is, through substituting technological innovation, physical capital, or increasing the education level of workers, human capital. Another approach is to boost women's engagement in the workforce in the United States. The current workforce participation rate for women in the United States is 56.5%, compared to 67.7% for men. Increasing labor force participation rates may necessitate family-friendly policies, such as providing low-cost or no-cost preschool childcare or encouraging fathers to play a larger role in child-rearing. Other policy alternatives are available. These include changing U.S. immigration policies. The number, and skill quality, of new immigrants could be adjusted upward if the legal immigration process is re-evaluated. Efforts from the private sector may also be beneficial. Assisting with childcare options, home-based employment arrangements, and part-time, job-sharing positions are examples of these. Ultimately, any proposed solution should be evaluated in the context of the alleged population crisis. Consider the programs that support elderly Americans, such as Social Security and Medicare. According to the Social Security trustees, the Social Security Trust Fund will only be able to pay scheduled benefits until 2033. The fund's reserves will be spent at that point, and ongoing revenues only will be adequate to cover 76% of scheduled payments. Similarly, the Medicare Trust Fund, which helps pay for inpatient hospital treatment, will only be able to completely cover scheduled benefits until 2026. After that, overall program income will be adequate to only pay 91% of total scheduled benefits. Please like and subscribe if you enjoyed this video. It helps others find our content. And please visit Econobits.com for a list of references and resources.